Coronavirus, COVID-19. Is it possible to catch COVID-19 infection from someone without symptoms? COVID-19 infection is mainly caused by spray that is produced by someone who coughs or has other symptoms such as fever or fatigue. However, many people with COVID-19 infection have only very mild symptoms. This is especially true in the early stages of the disease. The infection can actually be caught from a person who has a mild cough and does not feel ill. Some reports indicate that the virus can be transmitted even from people who have no symptoms. It is not yet known the extent of transmission in this way. What can we do to protect others and protect ourselves from infection if we do not know who has it? Careful hand hygiene is important at all times and is the best way to protect yourself and others. Keep at least 1 meter between you and others when possible. It is especially important if you are standing near someone who coughs or sneezes. And since some people with the infection may not have symptoms yet or have only mild symptoms, keeping a distance far from everyone is a good idea. What can I do if I have had a close relationship with someone with COVID-19? If you had close contact with someone with COVID-19, the infection may have passed to you as well. Close contact means that you live with or have been with someone with the disease in a distance of less than 1 meter. But if you live in an area where malaria or dengue fever is common, you should not ignore the symptoms of fever. Seek medical help. When you go to the healthcare facility, put a muzzle if possible, keep at least 1 meter between you and others, and avoid touching the surfaces around your hands. If the patient is a child, help them adhere to these tips. Even if you think you have not been infected with COVID-19 infection, but you have these symptoms, isolate yourself and monitor your symptoms. The risk of transmission is increased in the early stages of the disease when the symptoms are mild, so it is very important that you isolate yourself early. If you do not have any symptoms but you have had contact with an infected person, quarantine them for 14 days. If laboratory examination confirms that you have a COVID-19 infection, you should isolate yourself for 14 days even after symptoms have faded, as a precaution. It is not known exactly yet how long a person will remain infectious after recovering from illness. Coronavirus, COVID-19. What does self-isolation mean? Self-isolation is an important procedure for people with symptoms of COVID-19 disease. To avoid transmitting the infection to others in the community, including their family members. What is meant by self-isolation is when a person with fever, coughing or other symptoms of COVID-19 disease binds his home and refrains from going to work, school or public places. This isolation can happen voluntarily or based on a recommendation from a healthcare provider. What do I do if I have no symptoms but I think I have been exposed to COVID-19 infection? Self-quarantine is to isolate yourself from others because you have had contact with someone with COVID-19 disease. You should watch yourself for any symptoms that may appear during the quarantine. The goal of self-quarantine: people who have COVID-19 disease can transmit the infection to others immediately, so quarantine can prevent the transmission of infection. And in the case of quarantine, choose a spacious, very separate room with a toilet and hand hygiene supplies. If there is no separate room, separate the beds from at least 1 meter. Keep at least 1 meter away from others, including your family. Monitor your symptoms on a daily basis. Stay in the self-quarantine for 14 days, even if you feel healthy. If you experience symptoms of difficulty breathing, consult your doctor immediately. Coronavirus, COVID-19. What is COVID-19 disease? COVID-19 disease is an infectious disease caused by the last virus that was detected from the strain of coronaviruses. There was no knowledge of the new virus and its disease before it began spreading in the Chinese city of Wuhan in December 2019. COVID-19 has now turned into a pandemic affecting many countries in the world. What are the symptoms of COVID-19 disease? COVID-19's most common symptoms are fever, fatigue, and dry cough. Other, less common symptoms that some patients may have include pain and aches, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, a rash or discoloration of the fingers or toes. These symptoms are usually mild and begin gradually. Some people become infected without feeling very mild symptoms. Most people, about 75%, recover from the disease without the need for special treatment. But the symptoms are more severe for about 1 out of every 7 people with COVID-19 disease who suffers from difficulty breathing. The risk of developing severe complications increases among the elderly and people with other health problems such as high blood pressure, heart and lung disease, diabetes or cancer. All people, of any age, should seek medical attention immediately if they develop a fever or cough accompanied by difficulty breathing, shortness of breath, chest pain or pressure, or loss of speech or movement. Whenever possible, it is recommended that you contact your physician or healthcare facility in advance, so that the patient can be directed to the appropriate clinic. Coronavirus, COVID-19. What to do if you have symptoms of COVID-19 and when should? You seek medical attention. If your symptoms are mild, such as a slight cough or a slight fever, there is generally no need to seek medical attention. Stay home, isolate yourself and monitor your symptoms. And follow the instructions for self-isolation. When you go to the healthcare facility, put a muzzle if possible, keep at least 1 meter between you and others, and avoid touching the surfaces around your hands. If the patient is a child, help them adhere to these tips. Seek medical attention right away if you experience difficulty breathing or chest pain, pressure. Call your doctor in advance, if possible, so that they can guide you to the appropriate health facility. How does CK-19 spread? People can catch COVID-19 infection from other people who have the virus. The disease is spread mainly from person to person through the spray produced by the person with COVID-19 from his nose or mouth when he coughs, sneezes or speaks. These droplets are relatively heavy in weight, as they do not travel to a remote location but rather fall quickly to the ground. People can catch COVID-19 disease if they breathe these droplets from someone who has the virus. Therefore it is important to keep at least 1 meter distance from others. These droplets may land on objects and surfaces surrounding the person, such as tables, door handles, and stair handrails. People can then become infected when they touch these objects or surfaces and then touch their eyes, nose, or mouth. Therefore, it is important to keep washing hands with soap and water or cleaning them with an alcohol disinfectant.